Tonight's program is about cognition and multiple sclerosis. My name is Stuart Schlossman. Most of you all that are online already know that I too have MS. I too have memory issues, which is why this is a great topic for me. And yes, this is an event that is solely provided by our organization, MS Views and News. Here is Jeff Segal, and Jeff Segal is an MS exercise specialist. I've known Jeff for a very, very long time. In fact, Jeff was diagnosed just 3 months before me, and that goes back into 1998. So we've been around and we've been through the bucket a few times ourselves. And, if people want to reach out to either of us after this program, that's fine. But Jeff's going to speak with you about stretching and strengthening. He's going to speak for 30 minutes, and then we are going to do a few minutes Q&A.
How are you guys doing? First, I want to thank Stuart and my doctor, Dr. Steingo, who's my treating neurologist. Thank you for having me here. That was a great presentation, and I hope everyone understands that this is coming from an MS patient, not just a specialist in working with others with MS. So I'm going to give you some of my personal perspectives as well as researched information that's been somewhat conclusive. My topic tonight is strengthening and stretching. What I'd like to really do is talk about change, because everything that we're here for, the hopeful outcome is change, whether it's strengthening, stretching, everything that you heard Dr. Steingo just say. Hopefully he gave you some insight on what you can do to better changes for yourself. One of the things that I thought was very interesting was, and hit home, is picking a time to do the exercises. His exercises were mental and in the thought process type of thing. And I'm talking about physical exercise, but it's important to time it properly, know when the best time to do either of them are, and stick to those things that you know best, because like Stuart was just saying, this is 25 years into having a disease that 25 years ago, I was 25 years old. So this has been my life. And it's been more than half of my life of memory, because the first couple of years, I don't remember too many things that weren't traumatic. What I have learned, though, is as an MS patient, I personally like to exercise in the morning. I feel that there's a few good reasons for me personally to exercise in the morning. Because one is to get it out of the way, because as the day goes, you lose energy. And we know about the spoon theory. I like to save a certain amount of spoons in the day for the ability to eat dinner, the ability to do something after dinner and enjoy my life. Now, it's where exercise and strengthening and conditioning comes into play, because it does open up better thought, neuroplasticity, and the ability to think a little bit more abstractly. So with that being said, late in the day, like right now, I have planned for this. So I have a spoon or two left to give you some information with. So I'm going to spoon feed you guys. Strength and conditioning is what I specialize in. When I was diagnosed with MS, I was already in the strength and conditioning field. And that's when I was getting out of college with my degree, and I was ready to hit the world. And I was a young person, 25 years old, with no great stuff to look forward to. And then came the diagnosis. I still had a lot of great things that came across me, and I still do as we speak. And I apparently am going to have a lot more ahead of me. But I can't do those things without taking care of myself and without realizing who's my support, my family, my friends, my loved ones, the people that are closest to me. They don't have MS. They'll never understand what it's like to have MS. MS is something that you live with as a family, but the person who has MS is the only one that can actually feel what MS is like. So when you have obstacles put in front of you that you feel are deterring you from exercising, you're going to have one after another as the day gets going, later and later and later, until you get to the point where you might not have anything left in you to exercise or go out to dinner or whatever the things are to do. So I like to nail it in the butt early in the morning, so I don't have to worry about things coming up and not being able to exercise. Strengthening your muscles, stretching your muscles go hand in hand. When you're in an exercise program, especially for those who have MS, it's very, very important to go into your full functional range of motion. Meaning, if you're doing a shoulder press and you've got stuff in your hands, whatever the weight may be, and you lift it all the way up, when you're all the way up here, that's your full range of motion. Now, if you had an injury and you can only get to here, you can't expect to get to here because it's impossible. So you do what you can with what you have. And if you do that and you stay consistent with that, you're going to get more benefits out of a program. Consistency is the most important thing that you can do with exercise, because if you're not consistent, or if you change your program, or if you get bored with your program and you feel you need to change, your program's not really work the way you want it to, because exercise programs are progressive. They take time. It takes about 6 to 8 weeks for you to neurally adapt to a new movement. So within those 6 or 8 weeks, if you feel like you need a different program, that means you got to start from scratch again. Neurally adapt, get the motion, and after you've neurally adapted to the motion and it becomes smooth, that's when you start seeing strength gains and muscle gains. Now, having MS is the reason that a lot of people don't exercise, not just because some people think they're not supposed to, and that theory is just a theory that's pretty much been washed away. I haven't heard any physicians talking about MS saying MS patients shouldn't exercise. Maybe they shouldn't over-exercise, but exercise is key to everybody. If you're giving 100%, it's no different than someone who doesn't have MS giving 100%. It's still 100%. It's still the most you can do, and hopefully the best you can do at that amount. There's so many different types of exercises, like I've talked about in the past, and you can see a lot of this stuff on MS Views and News Learning Channel, where I go over different exercises. Some are push, some are pull, some are with bands, some are with exercise balls, some are with body weight. My personal favorite piece of equipment is body weight, because you can go anywhere and you still have it. Hopefully less than you exercise if you're trying to lose weight. For me, I'm trying to gain weight by exercise, and that's the right way to gain weight, because if you just gain weight and you don't do any kind of resistance exercise, you're gaining fat. The more muscle mass that you have in your body, the more metabolic your body is, which means you're going to burn more calories without doing as much, as long as you get the workout in. So if you eat a high-fat diet, and I'm tying diet into this because you are what you eat. So the more fat you eat, the fatter you're going to be, because the conversion rate is 1-to-1 when you ingest fat versus burning fat. Fat's the last thing you're going to burn when you're exercising or doing anything, because you have protein stores and you have carbohydrate stores that are used and readily available. But when those are all out, then you get to the fat. So that's why I'm not a big fan of the fat burning zone and all that stuff that you hear at gyms, because in order to get to the fat burning zone, you've burned X amount of calories, and then you burn the calories that are supposed to be fat. And everyone's a little bit different how they burn, where they burn, and their goals that they're going to try to achieve. So you can't spot reduce. So if there's one area that you want to burn more than another area, it's not up to you. Your body's just going to take energy from whatever source is available. And if you store a lot of fat in one area, you might not even use that area to energize or get energy stores until the end of the workout, or it might not be that part of the body. Most people say, how do I lose weight right here? And I think the best way to lose weight right here is by stopping putting stuff in here. Doesn't mean you're eating a bad diet, but it might mean that you're eating too much. So there's a lot of different types of things that go into building an exercise program when it comes to strengthening muscles. There's frequency, there's intensity, duration. There's different things that may come before you, obstacles, things to get around. But if you know what your exercise program is and your goal, the goal should stay the same. Goal is to build muscle. Keep that the same. A couple exercises can be changed. Movements are movements. So if I were to do, let me find something. Let's say if I was to do a shoulder press with this, and you look at my arm, if I'm doing this press up like this, what's going to build my shoulder muscle is the action between here and here. That's a shoulder press, right? It's the same action as if I was doing this. It's just this part of the arm is doing it. And it can be changed. So if, say, shoulder press is something that hurts you and you can't get up here with it, you can work your shoulders by doing this. Side raises, don't come above the shoulders with the hands, because then you're going to be impinging your shoulder joint. But the goal is to stick to the what your goals were. And when I say that, I start people off when I'm training them. And I'm going to get to some stretching behind me. I have a stretching table behind me, and I'm going to show you that. I'm also going to show you some stuff to do with a stretching stick, mobility stick. But when you're building an exercise program and you want to do stuff that's, intensity, mode, considerations, recommendations. You got to have a plan. And when you have the plan, if it's to build more muscle, you start your workouts in what's called a conditioning phase. Conditioning phase is reps range between 8 and 12 reps to failure. It can go as high as 15 to failure and as low as 6 and still be in that conditioning phase. And that's also hypertrophy, so that's going to build muscle. Because people who have MS may have some limitations, it might be a little bit more difficult to build muscle, or they may have lost muscle because of the inability to do the things that they were once able to do or didn't know how to work around it. But that's what I bring to the table. If somebody can't do something one way, we'll work around it and do it another way. If something hurts when you do it, my most common response is ask your doctor why it's hurting, or I'll suspect something and give them a list of things to tell their doctor. This, that, and the other is hurting when I'm exercising or when I'm sleeping or I'm doing something along those lines. I'm not going to diagnose anybody. I'm not a diagnostician. I'm a suspectician. So I'm going to tell you what I suspect. And I can tell you this. I suspect that there's a lot of people out there that are not breathing properly when they're exercising. They're not sleeping long enough at night. They're not drinking enough water. And those are 3 things that you need for life, just to exist. They say get 8 hours of sleep. I don't know who they are because I don't remember getting 8 hours of sleep. For me, 6 or 7 hours is a good night's sleep. Anything more than that, and I'm going to be dragging from oversleeping. It's just my natural time and duration of a rest. Other people can sleep for 12 hours and feel they're not rested. But the important thing is that you get your rest. If you have to rest during the day, you rest during the day. I come home a couple times a day so I can get a rest, even if it's just to sit down and close my eyes and regroup and then go back to work. It's something that everybody should have the ability to do. Don't think that if you're working straight through the day and you got all this stuff going on in your mind and you're thinking about this and that, it's not going to take an effect on how you perform outside of work or outside of whatever it was you were doing when you got to feel that way. Cardiovascular exercise, muscular strengthening, muscular endurance, and flexibility, they're all part of this routine. And what I was saying about a movement is a movement, and when you put your arm up like this, that's not just an exercise, it's a stretch as well, which is part of exercise. But I'm stretching my back by lifting my arm up like this. By coming back down, I get a little bit of a stretch to my shoulder. Same thing when I'm doing a bench press or a push-up. When you come out, you get a bit of a stretch in your back. When you come back, you're stretching your chest. That's all in the full functional range of motion. If your functional range of motion is not what it once was, you can stretch, but when you stretch statically, like these kinds of stretches, when you're reaching for your leg, it shouldn't hurt. You might be a little discomfort in the muscle. You shouldn't hurt through the joint. But what you want to do is you want to be able to do something that you can go to and get out of. Weakness comes from being too tight or too loose. If you're on this end of the spectrum as being too loose and flexible, you're going to have some weakness due to that. And if you're on this end of the spectrum and you're too tight, you're also going to have weakness. So the answer to both of them is strengthening. This pole here, it's used for PT a lot. It's called a mobility stick or stick mobility. For me, I like to use it for stretching. That's what they use it in the therapeutic setting. So I'm going to go into some stretching now. I'm also going to talk about strengthening. So I'm going to try to give you some stretches, tell you what muscles they're stretching or muscle groups or regions, and then tell you how to strengthen them as well. So if you have tightness in your side, your IT band is what runs along the side of your leg. This is a great stretch using this, pushing this way and moving your hips to the side. It's stretching my whole side of my body and my legs. Same thing as putting this in front of you and holding it. I'm getting the whole side of my body, some of the back of my arms just stretched. And then there's stuff where you can use this for even loosening up, which is key to stretching, because stretching something that if you do while you're tight, unless you're just trying to stretch during a muscle spasm, you should be warm. Your muscles should be warmed up, and you should have some more dexterity and flexibility once you've loosened up. If you don't loosen up first, but you plan on doing a stretching program or a flexibility program, you might hurt your muscles, because muscles are like rubber bands. You put them in the refrigerator and they're cold, you take them out and you stretch them, they're either going to snap or they're going to get longer than they should be and not work the way they're supposed to. That goes for your muscles too. So people who overstretch can have a decrease in performance. So back to the stretches I was talking about. The most common stretch you hear people say is this hamstring stretch. Hamstrings tighten up. Hamstrings are hip extensors. They're also knee flexors. So they do two things. These are the two motions that they do. This is hip extension, and that's achieved by hamstrings and glutes. And this is knee flexion, which is bending your knee against resistance, and that's going to also work your hamstring. What it's going to do is it's going to flip-flop the origin and the insertion, so that way you can achieve different things with the same muscle. Just like a bicep curl, you're bringing this closer to flexion. And same thing as when you're doing your leg and you're flexing your leg. But if I was to pull something towards me, the origin and the insertion flip-flop. So to stretch your hamstrings, the way we used to do it in school, when we were in grade school, hopefully they don't teach that anymore, was the hurdler stretch. That's by putting your back this way, and don't do this. That's the way we used to do it. Now we have the modified hurdler stretch, which is keeping your leg in, reaching for your foot. And if you can grab your foot, grab your foot. If you can't grab your foot, use something to grab your foot and pull it towards you and pull you towards it. If you feel the stretch behind your knee, you're stretching tendon. You don't want to do that. The pain behind the knee is not a muscle, it's a tendon. They can snap. And if you tear a tendon, it's going to roll up. You don't want to do that. So to prevent that, you bend it a little bit. So instead of just if you're not very flexible and you can't touch your toe, you bend your leg a little bit and you lean forward, you're still going to get the stretch in the belly of the muscle. Now, the exercises that you can use to strengthen that same muscle, one is a modified bridge. I'm going to bring this up here so you can see what it would look like. A modified bridge would mean, rather than having your heels on the feet on the ground, you can straighten your leg and lift your hips up. You could put your toes on it. You got to keep the ball on the ground. But if you put your toes on it and you lift up, you're working your calves and your hamstrings and here. But if you put your heels on it, you're using your glutes. That's how you strengthen your hamstrings. That's one of the ways. The other way is what I showed you are the machines where you would do flexion of the knee. Lower extremities tend to be more spastic with the flexors, hip or weak with the flexors. Flexors like the hip flexors or the knee flexors are very difficult, where in the upper body, like the flexors become tight sometimes. Some people have their arms, if it's really, really pronounced, in a flex position all the time and it's tight, and there's lots of things that you can do about that. There's pharmaceutical remedies, there's different things to talk to your physician about. Botox is something that you can use, not you, but your physician, and anti-spasticity meds. Baclofin's a very common one, but I'm not here to talk about the meds. I'm here to talk about what you can do in addition to what your doctor is giving you, or in some cases can replace medications if your doctor feels you're the right choice for that. So if you're having spasticity and you get into an exercise program that has a lot of stretching and you start to have less flexibility, you may have less meds that you're prescribed because you don't need as many meds you don't need that if you're solving the problem. So that's for the hip extensors and the knee flexors to stretch. But if you're going to stretch the front of your leg, which is the quadricep, these muscles right here, but not as much the hip flexor. The quadricep, you can stretch them similar, but it's a knee joint stretch. So if you're on your stomach, this is what it would look like, where somebody else can be there with you, which is what's very important. Know who your support is and know that they're going to be there for you. You know, the person that you're closest to or that's going to be exercising with you understands your limitations and understands what you're going through with MS, because they have no clue. They won't have a clue unless you tell them. And if you tell them and they're receptive to it, then it's a work in progress. And if they're not receptive to it, then that's what I was talking about with change. You need to change who the people are around you, so that way you can do the things that you do and you feel comfortable with their support. Support's like a shoe. You can have the nicest, most comfortable shoe in the world, but if that shoe is in your closet and not on your foot's got no support. That shoe is wasted in the closet. That's how support is. Your support is it's your go-to. And when you lose your support, there's more support. There's other support. You just have to look for it. But you should trust the people you're around and trust that they're in it for the same reason you are, because MS isn't a fun disease to live with. And it's not something that you will ever forget you have. And it, for me, is the most important reason to keep yourself as healthy and as fit and as conditioned as possible, because you don't know when you're going to go down. You don't know when you're going to have that exacerbation, that flare up, or your disease is going to start to progress. That's why if you're prescribed a medicine, especially disease modifying treatments by your physician, you find one that works for you, you should stay on it and do the best you can, regardless of how much the insurance companies don't want you to be on the medicine, because it's going to cost them money. You pay for your insurance for a reason to get your medicine, and don't ever stop that fight. And trust me, I probably spent more time on hold trying to get my medicine this year than I've spoken to many of my friends over the past 5 years just to get my meds, which I still haven't got, but we're working on it. And when I do, I'll let you guys know. So that's one thing. So squats are another exercise that are going to work your quads. They're also going to work your glutes. They're going to work basically everything from your feet up. So if you're able to do a squat, which if you're able to stand up, you're able to do a squat. This is what I would say would be the simplest of squats, finding something up this high and just standing up out of it from there to there. So if you can't see, I'm only going down about that far. If you can just do that, tomorrow it might be a little bit more. And I don't mean really tomorrow, but the next time you do it, you might be able to go down a little bit further. And that's the goal. You want to extend your range of motion. You want to be able to do more with what you have. And that's why exercise is so important. So I'm going to go back to the quadricep stretch. The quadricep stretch, which is I was showing you while laying down, it's not a stretch you have to do laying down. It's helpful to do it laying down. I like to do it when I'm on my side, or have someone do it when they're on their side. So that way it's easier to do. You can do it in your bed, on a bench, or on the ground. You just pull back like this. Now, my quadriceps are pretty flexible. Most people's quadriceps aren't the problem, because unfortunately, most people are stretching their quadriceps the majority of the day just by sitting down. If you sit down all the time, your knees are bent, your quadriceps are on stretch. That's why your hamstrings are more likely to have spasticity, because they're in a flexed position all day. So then when you go to stand up out of it, they're tight. Then when you sit back down, especially if you're underhydrated, it's a setup for muscle spasms. Hydration, hydration, hydration. I don't know too many people that are fully hydrated all the time as much as they should be. If everyone had a bottle of water nearby, start drinking it right now as I'm telling you this. Do I sound better? No. This is my late night voice. So that goes for the legs. Squats, reaches also. A reach is going to work the back of the legs, but if you bend your knees a little bit, it's going to work a little bit in the front for stability. That's just reaching forward. When you're doing a reach or a lunge or anything where you're going to pick something up on the ground, try to make sure that your shoulders don't cross your toes. Shoulders cross your toes, you're hanging on ligaments in your back. So it should look like like Spider-Man. No, if you're going to pick something up, that's safe if your leg's strong enough to do it, because my shoulders aren't crossing my toes. What you see too often, and that's why you see people saying bend at your knees to pick something up, would be people going to grab something way in front of them without putting their butt back. And what that's going to end up doing is it's going to cause your back to go out. So that's some simple exercise for the quads and the hamstrings. But one other muscle that's very important, there's actually a couple that I'm going to go into. Your peroneal muscles on the side of your leg and your hip flexors. The peroneal muscles are the ones that keep your feet from turning in, from inverting. So these muscles are the ones that prevent your foot from doing this. And if you've ever seen somebody's foot could do like that, that's the initial part of drop foot, where you can't get your foot back up. I don't have exercises for drop foot. The best thing I can tell you to do for drop foot is rest, because if you start to drop your foot when you're walking, the only thing that's really going to get you that energy and that signal back going from your head all the way to the end of the kinetic chain is going to be rest. So hip flexor. Your hip flexor, lift one knee towards your chest, and if this leg comes up, you know you got a little bit of tightness, so it'll look like that. I'll go sideways so you can see. Now I'm making my leg come up, but that's what'll happen. If you can do this without that happening, you might even want to hang your leg off something and lift. You see how my other leg came up? This is getting the stretch right here. I'm not that big on the peroneal stretches, but if you were going to stretch your peroneal muscles, it would be just pulling your foot down, stretching the outside of your leg. A glute stretch would just be crossing your leg and pulling the other leg towards you. And if you need a strap or something to help you with it, that's something that you might choose to use. So those are the hip flexor. Now, if you want to stretch your groin muscles, your adductors, grab your ankles, pull the feet close to you as you can, push down with your elbows. If I face you, you'll probably be able to see better. So it's here, here, and push down. Those are basically the lower extremity stretches, and I didn't say the calf stretch, but by pulling my foot back and stretching the hamstring, I'm getting a calf stretch. You can also do that by standing like this and having your back foot there and leaning into it. So I'm going to save the upper body stretches for the presentation because we're running out of time. But the key to what I was telling you is full range of motion when you exercise. Stick to your program. Whatever your program is, give it time. Don't quit because it's not fun. Change a couple things, but keep the goal the same. Make sure that you're going in that same direction. Sticking to that program. You start off with that rep range, like I was saying, and if you can't do as many reps, do as many as you can. If you can't get to 12, do the amount that you're able to do. It might not be because your muscles are giving out. It might be because your nerves aren't sending the right signal to your muscles. And if that's the case, your physician and your PT and see what you can do. But that's just basically a quick scenario of strength conditioning, stretching, and hopefully the outcome is you're stronger, more flexible, and have more ability. So with that being said, I hope there's some questions. Stuart gave me the 2 minutes, which just came up, so I'm going to open up to some questions.
Great. Thank you very much, Jeff. That was very, very nice. It was very good. We got several questions. Does lifting your leg only about 25% of the maximum have any benefit? And really, what is the true maximum?
Well, that's an interesting question. Lifting your leg to its maximum is different for everybody. We're all individuals. So if you lift your leg up, I'm thinking this is what you mean, lifting it up. Does it have a benefit? Yeah, it has a benefit because if you do it constantly, That means you can do it and you're practicing it, so you're going to be doing it more efficiently. 25%, if you can only do it 25%, I believe the question was, is that still going to help? That's a hell of a lot. That's 25% more than not doing it, right? So if you do 25% of what you're able to do, it's not 25%, that's 100%. 25% of what you envision yourself doing once upon a time back in history is your mind saying, I really wish I was still there, but you have to get back to reality and say, but I'm here and I'm going to work towards being at that point that I once was.
Great, thank you. All right, next one asks, what can I do for muscle spasms?
Well, Dr. Steingel gave a pretty good synopsis of different meds and different ways of working with spasticity. But on a non-pharmaceutical note, the things I was telling you about, keeping hydrated, maintaining your flexibility, continuing to work out, those things really have shown and there's proof that they do help reduce spasticity. So if you're expecting your spasticity to decrease by watching something like this, it's not going to do it. You have to actually do the work. And that's what people are missing, is the actual work. So work through it, stretch, and you're going to get the benefits from it.
Great, thank you. Next, wanting to know about things to do to strengthen my legs from buckling, gaining balance and gait.
So that's going to go towards, I understand a lot of what physical therapists do, and the thing I understand most is I am not one. And so gait and helping gait, what I can do to help gait is strength and conditioning, strengthen your muscles that are responsible for gait. But if your gait is off, it's really important that you see a physical therapist that can reintroduce the way you should walk. If you ever see someone with a swing leg, if they're walking and they're swinging their leg around, but they don't have drop foot, you know what I call that? I call that neuroplasticity. That needs a tune-up by your physical therapist, because what you've done is your body is not clearing your gait. Your gait's not clearing because your foot's dropping, but the neuroplasticity is you starting to swing your leg around. When you start to swing your leg around, that's a faulty gait. So a physical therapist can teach you what to do to get around that. So that's, I can't answer a question as a physical therapist. I can, but I wouldn't be practicing outside of my scope.
Great, thank you for your honesty. Let's go to the next one. When I exercise, I feel so good. Not only that I'm doing it, but that I pushed myself to do it. So how on earth do I recognize when it's time to stop?
Oh, if you don't know how to stop, then keep going. Exercises, like I was saying, it's a progressive thing to be in an exercise program. You do a little bit more as you go. When you can't do a little bit more, that means you've done too much. If you start to lose balance, coordination, your thinking is a little bit off, or you just can't perform the exercise, you've done too much, and you make a note of that so that way you can tell what's too much. Because if I gave you the exercise recommendations for people with MS, they're not much different than the people who don't have MS. Because we're talking about percentages of how much we're going to exert ourselves, not the actual outcome. We're just talking about pushing ourselves 70%, 80%, and the amount of times per week, 3 to 4 times a week. It's the same. It's just at your ability level.
Okay, thank you. Is there, somebody wrote a long dissertation about things, but I'm just going to get to the question. Is there a specific exercise that could alleviate spasticity?
I just have to say overall movement. If you continually move in a workout and get into what I was saying, the full ranges of motion, that might be the key to stopping your spasticity. It may or may not. Also, the static stretching, like I was showing. When you're doing a static stretch, you only want to do it. You don't want to do it for less than 15 seconds, and you don't want to do it for more than a minute. But you want to do it until you're in your comfort zone. So that's how you are your own advocate, and you build and you see how much is enough for you.
Okay, great. Thank you. Next one, if unable to stand without a walker, are chair exercises useful instead?
they're useful until you give up the walker. I mean, if you're doing stuff in a chair that you can't do out of the chair, you're doing great. You're doing what you're able to do, and in hopes that you'll be able to get out of that chair. And if you're using a walker and you think that you're just going to be able to walk better because you have a walker, or no, you have to put the work in, because you're using a walker because you're unable to walk without it. So if you're walking with a walker, you do the same. It's the same idea as if you're walking regularly. You set a goal. You try to get to a certain distance. You can practice that. That's going to be a lot of muscular endurance and just overall endurance. But that's what people who have MS need. They need endurance because they lack it.
Great, thank you. And last question before I get to a comment is, does stretching a muscle help strengthen it?
Okay, there's a bunch of different ways on stretching muscles. There's active stretches. There's passive stretches. That's active or assisted. Assisted is when you have something here and say someone's pushing you forward, or you have something pushing you forward. That's a type of stretch that's helpful. It may free up your range of motion and allow you to do a little bit more and get to a full range of motion where you can build muscle. But if the outcome isn't that, it's just stretching, and you're not able to use that muscle in its full range of motion, then no, it might not be helpful to building the muscle. That's why I think the best form of stretching is the exercise and the to do it in its full range of motion, because the full range of motion is full range of motion. That's flexibility.
Okay, thank you for that. All right, last, there was several people. Several people wanted to thank you, Jeff, for everything that you're doing. A person writes that, excellent presentation. I support you fully regarding the exercise, something that I've always valued and maintained since diagnosis in 1999. I wanted to read that one because it was very detailed for all the years that this person's been doing it. And so, but there were several others that did write in their comments, and all saying that they were glad to listen with you this evening. And we're glad to have had you online, but we're out of time, unfortunately, and we'll have you back another time to give you maybe a full-length show all by yourself. How's that? Okay?
Thank you. Thank you, Stuart.
Right.
And thank you for the comments, because I do this for that reason. I want to help people where I needed help and you needed help where there was no one that knew what we know now. And now we're able to share our stories and make people better.
That's right. So, Jeff, thank you. And thank you, everybody, for being online. Speak to you later. Take care. Thank you.
Thanks.
Bye. Good night.